Tinnitus is known for the ringing, clicking, buzzing, or hissing sounds you might experience. However, it isn't really a disease itself, but rather a symptom of a problem somewhere in your ear or the nerves that run through it. About 10% of people in the United States experience tinnitus each year, even if just for a few minutes. Sounds can show up in one ear or the other, and they can be loud or soft. People with severe tinnitus may have problems hearing, working, or even sleeping. Tinnitus that lasts for just a few seconds isn't necessarily unusual. Something as simple as a blockage can create these sounds, but more serious conditions can also be the cause. These include hearing loss due to high noise levels, ear infections, sinus infections, thyroid disease, and more. A large percentage of people won't have an identifiable cause. This is referred to as idiopathic tinnitus. While there's no cure for idiopathic tinnitus, there are remedies that can help reduce its intensity. One way to tackle tinnitus is to treat the underlying cause, primarily when that cause is hearing loss. When hearing loss isn't the issue, sounds-based therapies can still help by distracting you from the symptom itself. Most people develop tinnitus as a symptom of hearing loss. When you lose hearing, your brain undergoes changes in the way it processes sounds. A hearing aid is a small device that uses a microphone, amplifier, and speaker to increase the volume of external noises. This can help the brain learn new ways to process sound. If you have tinnitus, you may find that the better you hear, the less you notice your tinnitus. One survey of 230 healthcare professionals found that about 60% of people with tinnitus experienced at least some improvement with a hearing aid, and roughly 22% found significant relief. Sound masking devices provide a pleasant external noise that can help drown out the internal sound of tinnitus. There are many of these types of devices available, from tabletop sound machines to small devices that are placed in your ear. Most people prefer a level of external sound that is just slightly louder than their tinnitus, but others prefer a masking sound that drowns out the ringing completely. Sound masking devices help to cover the sound of tinnitus while you're using them, but they have no long-lasting effects. Modern medical-grade devices can be used to create customized sounds tailored specifically to your tinnitus. Unlike regular sound machines, these devices are only worn occasionally. You might be able to experience benefits after the device is turned off. Over time, you may notice long-term improvement in the loudness of your tinnitus. In 2017, researchers found that these devices were usually more effective than things like white noise at reducing tinnitus symptoms. However, these devices can be costly and are often not covered by insurance. Mindfulness meditation. In mindfulness meditation, a person observes thoughts, sensations, and feelings in a non-judgmental way, which may help reduce negativity and anxiety. A 2019 review of studies found that mindful meditation significantly reduced tinnitus distress in 6 out of 7 studies. The studies were of moderate high quality, and the evidence was clinically significant enough to suggest that mindfulness meditation may be an effective treatment for distress from tinnitus. A 2017 study found that although mindfulness meditation and relaxation techniques were effective remedies for tinnitus, mindfulness medication seemed to be more effective. Yoga is a combination of mind and body practices that can reduce anxiety and stress, which may help reduce the impact of tinnitus symptoms. One study found that practicing yoga once a week over 3 months improved tinnitus symptoms in 43 people with chronic tinnitus. More research is necessary to determine how effective yoga may be as a treatment for tinnitus. Further research may also analyze how yoga could improve tinnitus symptoms. Acupuncture is a form of Chinese medicine that people have used for thousands of years to treat a variety of health issues. It involves inserting thin needles into locations of the body at different depths. Authors of a 2018 randomized clinical trial note that studies have found mixed results on the efficacy of acupuncture as a treatment for tinnitus. Some research found no significant benefits, while others found that acupuncture may improve sleep and quality of life and reduce stress in people with tinnitus. However, the clinical trial found that acupuncture was effective and can reduce the loudness and severity of tinnitus in some people. Evidence supporting acupuncture for tinnitus is inconclusive. Acai products contain fruit from the acai palm tree. Acai fruit is rich in polyphenols, minerals, fibers, and lipids, and people often use it for its antioxidant and anti-inflammatory properties. One randomized, placebo-controlled study found that people who took acai had a significant reduction in the discomfort of tinnitus compared with the placebo group. However, more research is necessary to determine how effective and safe acai may be as a treatment for tinnitus. Acai supplements may be safe, but researchers have found a possible connection between drinking unprocessed acai juice and a life-threatening condition called Chagas disease, also known as American trypanosomiasis. Experts do not have much information on the safety of acai during pregnancy and breastfeeding or chest feeding. Acai may also affect MRI results. People use the root of the ginseng plant, native to China and Korea, for a variety of health benefits. Researchers believe ginseng could be helpful as a tinnitus treatment as it may have ear-protecting properties, which could help protect against noise-induced hearing loss and cochlear damage. More research and large-scale studies are necessary to determine how effective ginseng may be as a treatment for tinnitus. One study found that people who took 3,000 milligrams of ginseng per day had a significant reduction in the severity of tinnitus compared with people who received smaller doses or took ginkgo biloba. Ginseng is likely safe, although it may cause side effects in some people, such as insomnia, digestive issues, and menstrual problems. Ginkgo biloba is an extract from the leaves of the ginkgo tree. According to a 2022 review, various studies have looked at whether ginkgo biloba may be an effective treatment for tinnitus. Researchers believe that the antioxidant and vasodilatory effects of the extract may help alleviate tinnitus. A 2019 review notes that despite a lack of evidence to support ginkgo as a tinnitus treatment, more people use the extract than any other herbal supplement to treat the condition. If you think you have tinnitus, make an appointment with a primary care doctor. They will begin an examination by asking you about your personal and family medical history, as well as your lifestyle and any medications you are taking. Be sure to mention what kind of work you do, especially if you are exposed to loud noises, and any injuries you may have had. The appointment will continue with an examination of your head, neck, and ears. Your doctor may also perform some basic hearing and movement tests. At this point, your doctor may order additional tests or refer you to an audiologist. If you found this information helpful, please like and subscribe. Check out our channel for more healthful videos. If you're looking to start your wellness journey, check out our Self-Care Advocate program. Thank you for watching.